for joining us on TV47. My name is Tracy Mokami, and now as the world continues to look for ways to combat the deadly virus, for a fact we know that misinformation and disinformation on COVID-19 is the biggest threat to this fight against this virus. Now, due to the number of questions that we have had on this show, today we have decided In Other News is going to take a slightly different path. An all-doctor panel, all ladies, ready to dispel any myths and answer all your questions on COVID-19. So remember, the details at the bottom of your screen is what you will use to contact us. You can call us, reach us via Facebook, via Twitter, on our Instagram page, on our YouTube platform as well. Now, these ladies are not new to In Other News. They actually participated in the Don't Rush Challenge in a very unique and educative way. Now, in case you missed this episode, of course, you can catch this on our platforms online. These doctors are here. So before we even get to introduce them to you, let us look at this video, then come back with an all-doctor panel. Thank you so much for joining us, doctors, I don't know. we have Dr. Karen Mudemba.
Hi.
We have Dr. Chepto Kogo.
Hi.
We have Dr. Ida Wanjiko.
What's up?
And we have Dr. Irene Nduta.
Hello.
I don't know, everyone is asking me where did we get such pretty doctors from? Yeah? It's going to be an amazing, interesting conversation. Now, in the last week, we have reported cases of escape from quarantine in Kenya, Uganda, and even other countries. How important is quarantine in the fight against COVID-19? Irene?
It's important because if you've been in contact with anyone who has symptoms or is a suspected COVID patient, or a person, it's good to go into self-quarantine so that you're protecting yourself as well as the other population.
I'm curious though, within these quarantine facilities, we have seen cases of infection within these facilities. Does then this mean, because when we speak of quarantine, I'm imagining a scenario where everyone is on their own and not really interacting with other people. Dr. Ida, how different is quarantine from isolation, and what exactly is the mental picture that we should have when we hear quarantine?
All right, thank you so much for that question, and thank you for tuning in. Thank you for having us. So there's a difference between social distancing, quarantine, and isolation. Social distancing is basically what any person who is not infected with coronavirus is supposed to be doing. You're supposed to be standing or sitting or interacting with anybody at a 1.5 to 2 meter distance. That is what we mean by social distancing. Number two, social distancing means you do not go to any place where we are gathering in groups, in churches, in mosques, in temples, in markets. So that is what we mean by social distancing. Quarantine is now where we have a patient who is either suspected or has tested positive for coronavirus, and so we are isolating them from their home, their family, their community, put them at an institution of care for 14 to 28 days until they test negative twice for coronavirus.
When you speak of the need to quarantine these people, there have been complaints that these quarantine and isolation centers have actually become incubation centers for coronavirus. Dr. Karen, how can the people inside these quarantine facilities even protect themselves further from contracting the disease?
Yeah, thank you so much for the question. I'm very excited to be here today, and I'm happy, and I hope all of you are watching and getting something from this. It's very interesting what's happening right now, especially in the quarantine places. There's been, of course, cases of where even the people taking care of those people who are in quarantine are actually getting the disease. So it comes down to individuals, basically. You as a person who has been put in quarantine, especially by the government, it's important for you to take care of yourself. And you know, the government can only do so much, and you can only help yourself so much. So for these people, really what I would say is that you need to follow the guidelines and the proper procedures. Make sure you wash your hands all the time. Make sure you keep your safe distance. That is like 2 hand distance between each other. Make sure you do not come into contact with someone without a mask. Even when you're on your own, just make sure you're wearing a mask. Keep yourself safe. Those 3 main things are the most important things that you need to keep in mind, especially in quarantine areas. Yeah.
Dr. Chepto Kogo, that is the name, yeah?
Yes, it is.
No, I'm wondering, I know you take care of people from all demographics, so I know you take care of people from the vulnerable groups as well. What happens to people who are not able to achieve social distancing, probably due to congestion, the fact that where they live, for example, slum dwellers, they have not been able to achieve this? How can they protect themselves in an instance where they find themselves not able to achieve social distancing?
Well, thank you for that question. So what I feel is the right thing to do in terms of the slum dwellers. As we know, we are not able to control their living conditions. Most of them are living in very congested conditions. Most of these things will be mostly government initiatives to be able to introduce water points for people to be able to wash their hands, to be able to distribute sanitizers, because some of these people are not privileged enough to buy some of these sanitizers or soaps to wash and sanitize adequately. Also, they should be able to come up with either funds or drives to supply masks and advise the people. Mostly it's communication, advice and information dissemination to these groups to inform them of the coronavirus, how dangerous it is, what complications one can develop after contracting the disease, and what is the importance of social distancing, even if they're not in the favorable conditions that you would expect or wish them to be in.
All right, so you mentioned masks and sanitizers, and these are among products that are really in high demand right now, and entrepreneurs have decided that this is the way to go for them, and they are actually selling these products. We have seen different types of masks, different types of sanitizers. Dr. Ida, how do we differentiate, or what actually are the masks that can actually protect us? Do all these masks being sold work?
All right, so about masks, we have 2 main ones that we use at the hospital setting. We have the N95 mask. Of course, China is China, so they had to bring the KN95 mask. So that is in one category. They have a respirator or a filter, which is, of course, what we are using for all the centers that are for isolation for all health workers. We also have the 3-ply surgical mask. That is a common mask that any other person at a non-hotspot space in the hospital is using. We have also gotten people who are entrepreneurs, and I actually salute them. Thank you for bringing innovation into the healthcare. And so I like what the people at Ukambani, was it the textile, the Kitui textile? I remember that. Somewhere in Ukambani, I think it was Machakos or something, or Kitui. I like what they're doing. I like that they made the masks, and then they had to be certified by KEBS, meaning that there are standards and that you need to use when you are actually making the masks.
You see, the problem is these masks that have actually gone through the process and have been certified by KEBS are not getting themselves into the Kenyan markets. So we are witnessing a scenario where we are seeing people using masks made out of kitenge fabric and all these other fabrics that I do not know for sure whether they are actually helpful to help people not catch this disease. Dr. Irene.
So what I can say is if some people don't have the funds or the resources to get the N95 or the surgical masks, then instead of just going out to town or wherever they're going without anything, then they can use those cloth masks that are being sold out on the streets.
So then the protection is actually the same?
No,
it's not the same.
It's not the same, but it's better than nothing if they
All
don't
right.
have anything.
Yeah.
All right.
Yeah.
So before this show, a few minutes before we started, I was asking Dr. Irene if she has actually seen people in face shields. Governor Mike Sonko and other people we have seen covering their whole faces. Is this sufficient, Dr. Irene?
It's okay. For the ones I've actually seen on the street, they have the face shield, but they're not wearing a mask. So that's not protective because anything can go through those masks. And then what I've seen is there are also there's the homemade ones, and then there's the actual legit ones. So it's also different, but it's not as effective if they don't wear with a mask.
All right. So I don't know if
As I
their
said,
rationale
these are not
was the
detention
fact that
centers.
our eyes are exposed after we wear the masks. Maybe that is what they were trying to protect. I don't know. But guys, you had it from the experts. You don't just wear the shield and imagine you're fine. You need to wear your face mask at all times in public. Now, Dr. Chepto, I'm wondering, homemade sanitizers. For the people who cannot afford to buy sanitizers, we know they are a bit pricey. The prices are not favorable for everyone. Do home sanitizers work? Homemade sanitizers?
Okay, there was, when this pandemic hit the country, there was like the sanitizers got lost in the market because everyone hoarded at some point, and there was a directive, or let me say instructions, that were given out on how to prepare your own sanitizers at home. And they were using surgical spirit and glycerol, at least glycerin, for the lubrication part. So there was a ratio that you could be able to mix that to achieve that. At least that can confer some help, because not everyone is able to access the alcohol to make their own sanitizer. I believe it is good enough to help, but remember, when you're using that one, at some point when you see your hands are dirty, you need to wash your hands. You can't sanitize the whole day without washing your hands at different points during the day, because you still have to wash your hands.
All right. I'm wondering, Dr. Karen, in the event that we have actual fake sanitizers, many companies have come up and the certification process not really being followed. How can we identify a real sanitizer that works and one that does not work? Is there a way we can be able to do that?
Really, we have a lot on the market, and it would be very difficult for the layman to actually tell this is good sanitizer or not good sanitizer. What I would say is really take what, like we know very clearly the brands that have been there for a while and have been legit. So you should be able to pick those brands specifically. Other new ones might be for real, but the best thing would be washing your hands all the time and take what you know is usually legit all the time. If you take the others, we even ask for us as medical professionals, we might not even know which one is for this is how many what percentage alcohol this one has, how much of what component it has, but just take the ones that you're sure are the ones, and always remember to wash your hands, because washing your hands is the most important thing, really. You might not even need to walk around with sanitizer. Just make sure you wash your hands, because most of the places, even in town, in restaurants, even right here, we've had to wash our hands prior to doing anything. Yes.
All right, then this means the people who are making these sanitizers, you're running them out of business when you tell us to just wash our hands, stick to washing our hands. Now, yesterday, the Council of Governors said that over 14,000 healthcare workers have been trained to combat COVID-19. Now, the training schedule for workers, does it include all doctors? Will we see a situation where every medic is going to be trained to fight COVID-19? Dr. Ida?
Well, that would be the ideal. That would be the ideal scenario, to have all health workers of all cadres, meaning doctors, clinical officers, nurses, and paramedics, if possible. But we may not be able to achieve this at this time. But what I could say is, I honestly commend the Ministry of Health. For the first time in my third decade of life, I have seen the government pull resources for one agenda. So I want to really, really congratulate the Ministry of Health. Honorable Mutai Kagwe is just the the fresh of breath air we needed in 2020 for the new decade.
I'm glad you mentioned that the Ministry of Health and what they're doing. Later on in the show, we'll be trying to analyze. The rest of us are feeling like maybe tea worth a few millions and printing papers worth a few millions is not what we would call a good job. But right now I want us to delve into how you as healthcare workers are actually taking care of themselves. Because we have seen instances where medics have come out to say their welfare is not being taken care of as they should. Dr. Irene, how are you taking care of yourself personally, even before we go to the measures that the government is taking to protect you?
Okay, so in the hospital setting, before you go see patients, you need to have a mask. So you can actually say, I can't see this patient without a mask, because you also, at first, you need to protect yourself as a person and as an individual. So at least the hospitals do provide the masks. And then if you're, for instance, in outpatient, then you need to wear the PPEs. That's where you wear the full gowns, the boots, the eye shields, because you don't know who's coming in, whether they could be COVID positive or they've been in contact with anyone. So at first, the most important thing is to protect yourself. What we've been saying, using sanitizers, washing your hands, and then also having a good communication with your staff, your team, because if you feel like you're having a burnout, then you also need to go take rest, take a break, because you can't help others if you're not healthy yourself.
For sure. Now, Dr. Karen, I have seen in other countries, the medics there say that you do not even come into contact with your family, even when you're taking care of COVID-19 patients. How does that work? How do you survive not seeing your family for extended periods?
It's very possible. It's very possible because I'll talk personally for me. I haven't seen my parents in a very long time. Actually, it's been a month, almost 2 months now. And I know they're watching this right now, so it's very possible, because if you really, really love your family, you'd rather be taking care of them in this way. And for us, most of us, we do the same thing. We consider the fact that we are exposed or we are people who are basically going to a place where we are easily exposed to this coronavirus. So it is very possible. We actually do that a lot.
So you say then that everyone who is a front care worker right now has not had the chance to be with their family?
No, not necessarily.
Okay.
No. Yeah, there are actually some people who are going back home. They may be living with their families, their nuclear families, but they are taking the measures. There's specific maybe areas that they might not be in contact with the children as much as they would be or would have liked to. There was a video even that went on viral about this doctor who went back home and the child was running towards them and they couldn't hug them at all. I think for those ones, that's what they're doing. But if you can actually keep away from your very, very close people, then that might be the best thing. Yeah.
And that is such a huge sacrifice. So thank you so much to all of you and every other healthcare worker out there who is making such huge sacrifices. Now we talk of how we can physically protect you as caregivers. And I'm wondering, we have seen that in New York, unfortunately, one of the medics was not able to handle the pressure very recently, I think 3 days ago, and actually committed suicide as a result. Dr. Chepto, what are the measures to help caregivers to be able to address mental health issues that might come up as a result of taking care of COVID-19 patients?
Okay, mental health issues have been there for the longest time, not only amongst health workers, even the general population. As you would have seen in the recent past, the suicide rates have increased because of one reason and another. But the disease, COVID-19, has come in a very strong way, and it has affected everyone almost equally, or some, you can argue, more, especially to the health workers. And we've seen other countries that have been hard hit as compared to some other nations. And the healthcare workers are really undergoing so much stress in those countries, and even in the countries that are not as hit, because you don't know how a person copes personally with the issues. So what I have seen that is being done in the country currently, there are hotlines that you can call when you're having when you feel like you're overwhelmed and you want to speak to someone, you can call these hotlines and speak to someone. And also some facilities have set up like groups where you can talk and decompress, and also share issues that you're going through during this time. The anxiety that comes with handling patients who might be having COVID that you don't even know, you're just suspecting, is quite high. Also, for people, I would advise you try and look for coping mechanisms. Try and do exercises at home. Try and do some relaxation. Try and do some meditation. There are so many videos on YouTube. There are so many podcasts that you can listen to that can help you. Also, avoid watching so much about whatever is going on around the world, because it's going to give you so much anxiety when you see the death toll in other countries, when you're seeing how the other
really,
people...
doctor, you're telling these people to give us media blackout?
Not really media blackout. It is a way of coping. When you feel like you're not able to handle it, I believe you can take a moment or even a day off anything that can cause you to have the anxiety. Just use whatever you can. You can also like try and do things that you like doing. Look into your hobbies. Try and do them to try and remove the stress that you're experiencing.
All right. So after this break, we will come back and look at how to help you stay healthy during this pandemic period. Now, before we go on a short break, Dr. Ida, I am wondering what is the reason that the numbers in Kenya are still relatively low? Is it something we are doing right? Is it sheer luck? What do you think?
I think it's because we're still under testing. We need more tests, guys.
All right.
Somebody, WHO, anybody, do something. We need more testing for real, because, I mean, out of our population, how many are we? 48 million? And we've only tested 19,876. That's a joke. So we need more tests. Testing, and more testing.
All right, sawa. Thank you so much. So thank you for staying with in other news. When we come back, maybe we shall actually ask the doctors to dance for us, like just as we did, as we saw on the videos. Stay tuned. We will be right back.
Look at gesturing. It is on the same point of affirming. But in this case, on gesturing, this is where, as a teacher, you are working.
The second reason why entrepreneurship is important is also that it helps you to plan for business finance. Business finance here simply means how much money do you need at the point of starting the business, and when is it needed, and is it for a short period of time or for a long period of time?
We still feel that the tourists are not getting value for their money. That experiential experience they are looking for is not there.
Kila baada ya miaka mitano tunawachagua. Kwa kazi zao za ofisini tunawafahamu. Lakini je, unajua maisha yao zaidi ya ofisi?
Naomba Mungu kwamba ndio kabla hajaniokoa nikuwe bishop, anipatie mpaka ile kipawa ile ya kuona ile ya ukweli, si ile vitu ambayo kinanganga wanafanya hapa ya ukora.
Milima na mabonde tutavuka, kaunti zote 47 na ikibidi nje ya nchi tutafika, ili mradi kuhakikisha kuwa umewafahamu.
Ile ningetaka kusema ni kwamba that vile tumelelewa tukiwa ndani ya biashara. Kwa hivyo biashara ilikuwa ndani yangu. Hii maneno ya kuandikwa ilikuwa tu formality kidogo upate laini.
Wale waliopo na wale waliokuwepo, wote kwa mpigo tutawapata. Nitabisha, wakifungua nitaingia, kisha nitakupeleka kwa utaratibu katika safari yao ya maisha.
Kumbusha nioe 1992.
Nani alikukumbusha?
Ni mama alikuwa anatukasia sana, anasema lazima vijana muoe.
Hayo yote utayapokea katika kipindi Mfahamu Kiongozi, nami Elizabeth Mutuku, kila siku ya Jumatano saa 2 kamili.
Thank you so much for staying with In Other News. My name is Tracy Mokami. Interesting set of questions coming in. I start with one from Miriam. She says, Salimia Dr. Chepto Kogo, aka Magda. I did not know that. Tumecheza volleyball sana na yeye. Good to know. Yes. So, Jojo here asks, what's the point of masks? In the UK, distance is the most important thing. Masks don't really help if we're still touching each other. Dr. Irene.
That's true. Masks are important because, let's say, for instance, someone on this corner is sneezing and coughing and they're not covering the proper way. So those droplets will still be in the air, and then let's say I walk and I don't have a mask and I'm compromised. It's easier for me to now contact if they were COVID positive. So it's important to have masks.
All right. Okay, and Jacinta Onjiko asks, how will this fight be won without a vaccine? Kari.
That's a very good question. Usually for almost all the pandemics, like I think we used to have, there was a swine flu at some point, most of them had a vaccine, and that's true. We actually need a vaccine to be able to combat this disease. But before we get there, because it takes a very long time for a vaccine to be made, in fact, it can even take years. And if we're lucky, maybe in a month or two, we still do not have a vaccine right now. We need to really concentrate on preventive measures and keeping yourself healthy, because we can't be waiting to get a disease so that we can get a vaccine. The main thing is preventive. But if at all, in this case now that we actually have numbers of people with the coronavirus, we just need to, for them, they have to just know that yes, it's possible to get better. It's very possible. With your immunity, you're going to fight it, and you have to keep a positive attitude also with it. Yes, there are deaths, but the deaths are way less than the ones who are living. So you have to keep a positive attitude. And as we wait for the vaccine, let's try and keep ourselves healthy and prevent getting the disease.
All right. So someone else here asks, how is it possible for people who have contracted COVID-19 to avoid reinfections? Dr. Chipso.
Well, we have seen in other countries that some people are getting reinfected, especially in China. They are reporting a new wave of cases imported from other countries. And basically, let me resonate whatever Dr. Karen explained. If you are positive, you are quarantined, and then you tested negative twice, and you are released back to the community, then it is up to you to keep yourself safe and also protect the rest of the people who are around you. Also, for the people who are going to leave the quarantine areas, it is good that people don't discriminate them, because COVID is just like any other viral disease that after it leaves the body, you get some sort of immunity. But as we have seen, it doesn't confer much immunity, as we are getting new cases reported for people who were tested negative, like even a month earlier, getting positive cases, positive tests again when they're tested. So just wash your hands all the time, sanitize adequately, put on your masks, and keep safe. Do the social distancing as need be, and stay at home as much as possible.
Now, I am wondering if this is the new reality we might have to be living with, just like TB came and then infections really went down, HIV as well. Dr. Ida, are we going to live with COVID-19 for extended periods? Is it going anywhere anytime soon?
I love that question, because I always keep on telling anybody I meet anywhere that you need to adjust to the new normal, COVID or no COVID. I mean, I was so sick and tired of I am at a bank and then you're breathing just behind my neck. I mean, people, please, social distance. So for me, coronavirus is amazing. Thank you, coronavirus. Thank you.
Wow, okay.
Yeah.
Really?
You know, and then this whole handshaking thing, you've gone to the washroom, you've not washed your hands, you've picked your nose, and then you come and give me your hand to shake your hand. So Mimi, coronavirus took our best friends, BFFs.
Wow. It will prevent cholera.
So yeah, and then of course it's preventing a lot of diarrhea, gastroenteritis, cholera.
Normal
I mean,
flu.
this new normal is amazing. I mean, what is not good about it? I mean, for example, I have used to feel victimized for not attending physical church. And you know, I'll be looked at like, you know, church. Now church is online. So
that makes me an excuse for not attending church.
I mean, you know, now I can just, you know, bedside. I put on Reverend Julian Kula Papa Center. I watch. I praise in my house and I dance in my house. I mean, you can do takeouts. You know, now we've even given Jumia, Glovo, and all these other companies a lot.
Last week, someone in this show was saying maybe it's the high time we started attending church service with a bottle of wine next to our beds. It's
well,
crazy. That's a story for another day. All right, so now for people staying at home, the biggest challenge has been overeating and lack of exercise. How can we ensure that we remain healthy during this period, Dr. Karen?
That's a very good question, because even us as doctors, we actually have some time off. Actually, now it's much easier because we have less time with patients, and then we have a bit of time also to rest because we can't be exposed too many times. And we end up going home and staying home and actually having the binge eating as well. And it happens. But I think you need to look at it in a different way. Being at home, you actually now have time to exercise for even 30 minutes a day. In fact, I'm now exercising myself every day for 30 minutes, which is the best thing you can ever do. So don't look at it only at the side for eating, but you can also exercise to counteract that kind of eating. And then every time you're eating, remember that plate of food right in front of you determines how you'll be in the next 1-2 months. Every time before you look at it, remember that it's gonna change something, or it's gonna, think about it like it's gonna give you nutrients, keep you healthy, but don't think about it in terms of whether it's gonna make you gain weight or lose weight. Just make sure you have the healthy portions. You have that big portion of vegetables, I'm saying, guys, vegetables, not meat. Vegetables. Put that small size of meat and then put that small size of carbohydrates. You can actually be very full by eating just vegetables, in fact. So just remember, every time you just need 30 minutes to eat something to change your life for the next 2 months. So think about it before you actually eat. And then, of course, always communicate with your doctors if you actually have any conditions like diabetes, hypertension. Sometimes you might be able to get information from them. And even nutritionists. At this point, we probably all need nutritionists to talk to give us, what to eat at what time, especially depending on our body types. So don't ignore that. But the main thing is what you eat is what you are.
Yeah. All right. Okay. Good insights there. Now, one of the ways that people are entertaining themselves during this period, this is a very random question. I don't know if you guys have seen COVID radio, quarantine radio, club COVID, all these hilarious things people are doing online. And someone actually asked me particularly to ask this. Ladies are going to extreme lengths, such as putting milk, oil, flour on themselves as they try to entertain themselves. Does this have health repercussions, Dr. Irene?
No, I think they're just having fun and killing time because right now people are bored staying indoors. So there's so many challenges, so many things people are doing. As long as it's not bleach or disinfectant. Exactly. Don't pour that on your body because then that's dangerous. But like flour, that's okay.
Yeah.
That's people killing time.
I have seen kids smile for a minute. Tomorrow you will be telling us your response on this one. So I am wondering, during this period, a lot of reports have come out to say that people are avoiding hospitals because of the fear of infections. Now, the people who are really vulnerable at this point are mothers, expectant mothers, and people who are going through antenatal, postnatal care, Dr. Chepto, what word would you have for expectant mothers during this period?
Okay. Yes, we are seeing a drop of the number of cases coming to the hospital because people are afraid to get the coronavirus. But there are certain special groups that we would like to put emphasis on. Patients who are immunocompromised in one way or another, patients who have hypertension, patients who have diabetes, and also the pregnant mothers. These are conditions which you can experience emergencies at any point, and you will need to seek medical attention. So, in as much as they're supposed to keep off the hospitals to prevent themselves from getting infections, they are also supposed to know that when they get any emergencies, especially for pregnant ladies, there are certain things that are known when you're experiencing a fever, when you're experiencing a headache, when you just suddenly feel dizzy or fainting, when you have either bleeding or spotting. And I will also ask my fellow gynecologists in the house to expound more on that. When you experience such emergencies, there is an initiative that has been rolled out by one of our very good friend and colleague, Jemima. And we will also give you the hotline number that you can call when you need any assistance to get to a hospital. Don't feel afraid of going to the hospital if you're having an emergency. You can always try and negotiate with the police, but just make yourself get to the hospital to get the attention that you need to be able to be assisted, especially for the pregnant ladies.
All right. Okay, Dr. Ida. This specifically touches on your area of expertise.
Oh, yes. Mothers, women, ladies, girls, vaginas. It's my pet subject. So basically what Dr. Chepto has said is actually one of us. I think you saw from the initial video that we were 11 ladies, 11 fantastic, trendy doctor babes. So the second one that comes on the video is actually Dr. Jemima Karaoke. Hello, Dr. Jemima. Yeah, so in collaboration with AMREF, KEPSA, University of Nairobi, Kenyatta National Hospital, and I think other hospitals, she has single-handedly come up with, with our collaboration with Bolt, formerly Taxify, that actually gets all pregnant mothers to hospital for free.
Amazing. Okay.
Yay! So I'm so proud of her. So. Yeah, there's actually that service, and I think everything has already been, the poster has already gone, it has done circles in Twitter, on Facebook, on Instagram.
All right, I think we'll be sharing that as well right after this show.
Yes,
so keep on the lookout for all of these details. Now, I am wondering, is there a way that the cessation of movement has affected you as healthcare workers? Early in the week, we saw healthcare workers stranded at the borders of Nairobi area. Dr. Karen, when patients are stuck in one county, they need to move to other counties. What is happening?
Thank you so much for that question. There are cases actually I've seen of patients who've had to travel from one part of the country to the next. What they are doing currently, you just need to go to the police station, and then they give you there's something they write for you so that you're able to show the police along the way that you're going to a hospital in a different town. For example, if you're coming from Kisumu and you need to go for maybe specialized treatment in Nairobi, you just need to go to any nearest police station, then they give you a clearance form for you, and then they allow you to pass the different points where they will be checking you. So don't worry so much about that. If you actually have a genuine reason, you will be allowed to pass. Unfortunately, we've had cases of people, even medical doctors, being denied to pass. It would be important even for us to remember to carry, because this has not been put for nothing. It's for a reason why Nairobi has been locked within itself, Mombasa, Kilifi. It's for a reason. So even for us, we just need to carry the right documents. And even for the police, they need to also allow us to also show our online documents as well, because even those ones are still the right things that we can use.
All right.
Yeah.
Okay. So now Madagascar has announced a supposed cure for this virus. The herbal remedy is not a first in Africa, because we have seen other countries such as Egypt, Ethiopia as well. Kenya not being left behind. We saw communities in the coastal region try come out and say we have these teas, we have these saunas that we are making by ourselves. Dr. Irene, are herbal remedies the way to go, and are they effective?
So herbal remedies, herbal
remedies
will not cure corona.
But, okay.
So let's say for instance, you know how you boil, you have your garlic, your ginger, your lemon for like a common cold. You can take that in drinks. It helps soothe your throat. It helps, but it's not a cure. There's no cure yet for corona.
Jacinta Wanjiko here says, sasa tutafanya nini na tulikuwa tunategemea maji ya ndimu na ginger.
I can answer that. I can say that you can actually supplement, you see. When you are on treatment at the quarantine centers or the isolation centers, there's what they're using. For the mild, I think we are fortunate as Africa, as Kenya, that we are only using chloroquine and azithromycin as a treatment. For the people who have been admitted. But you can as well supplement. You can do majimoto, ndimu, ginger, koroga, garlic, insert there, put honey, put any other thing you want to put, and drink. So it's okay. It's really okay. Yeah. But I want to just say that there is actually no cure. There is no cure. Don't lie to yourselves. It's not come yet. There are scientists all over the world who are not sleeping day and night trying to see what they can come up as a cure. I would also want to say that there has been studies, I think done in, is it Italy? I'm not sure the country, but it's abroad. And they're also showing that there's a certain type of antiretroviral, an ARV, that is working, but it's for the severe form of coronavirus. All right. We are lucky as Africa that so far we are getting mild form, the milder form of coronavirus. And so we thank God for that.
Now, Dr. Chepto, I am wondering if then there is no cure, what we are left with is attempting to boost our immunities so that we are able to fight the virus. What are some of the ways that all of us can boost our immunity just to be able to be strong enough?
Okay, first of all, whatever you eat really determines how your body will be able to fight common infections. So please watch whatever you're eating. Avoid junking a lot. Most of the junk foods don't have any nutrients per se. Most of them are cooked using trans fats, they're cooked using synthetically processed and a lot of salt and sugars, which cause an imbalance in the hormones in the body in terms of how the body is supposed to work and the metabolic rate of the body. So watch what you're eating. As Dr. Karen mentioned earlier, she said that you eat small portions of carbohydrates and proteins and then a huge amount of vegetables and fruits. It helps with the roughage and the fiber, and most fruits, especially the vitamin C rich type of fruits, have been shown to help with boosting the immunity. All those yellow colored fruits, the lemons, oranges, you can do grapes, you can do mangoes, pineapples, the acidic type of fruits are good. Now for the ones who might be having issues with, we call it gastritis, who cannot take these acidic type of fruits, I think you can get the supplements from the hospitals or from the pharmacies of these the vitamin C's. Then, so I've mentioned the diet, I've mentioned supplements, and also you can do exercises. It helps boost, it brings some energy, some bursts of energy in your body and helps also fighting and warding off infections.
All right. Yeah. So I am curious, the fact that all of your medical doctors, I hope you spare a minute or two just to keep in tabs with current affairs. Now, restaurants are actually set to reopen. Dr. Irene, will the opening of these restaurants trivialize the steps that we have made as a country in the war against COVID-19?
Okay, in my opinion, I think we would have been better off to do takeout instead of guys going, sitting in, eating. But I get the whole aspect of businesses and workers who work in that, but we also need to look at the bigger picture. We'd rather that Corona be contained and that our numbers don't go as higher as high up as we've been seeing in Italy, Spain. We'd rather contain. But now because restaurants have opened, then they need to take the specific measures. Before you come, wash your hands, sanitize, the whole keeping the 1.5 meters away. They also need to be testing their workers because they're the ones now in direct contact with the people going to eat. So
and maybe even ensure that they're selling healthy foods only, so that we do we expect people to be ordering junk food and then we will find them in your hospitals because the immunity is very low.
Exactly.
Another trending topic, we come to you, Dr. Ida.
Oh, I love it. Is it the church? The church?
No, it is actually, I am curious, did you partake of this tea that cost millions? Now that you are very excited that the Ministry of Health is doing right by you, what do you feel about the numbers the Ministry of Health gave?
What do you mean by numbers?
So the COVID-19 funds that were released,
okay.
You have seen the breakdown of this, how this money was spent.
Oh yes, about the money, the tea, the whatever.
Yes.
I mean, well, I would want to say that it is fantastic. People, everybody, the president, His Excellency, Vice President, they're all taking pay cuts and doing all these fantastic things. Amazing. But where is the money going? It's like there's some hole somewhere where it trickles down and then it doesn't get to us because...
We are being told you guys took the tea.
Where?
They have actually outlined and said we bought tea worth a few millions. We bought printing services cost us a few millions. I don't know from as a doctor, please appeal to them. Maybe they might listen, not to waste this money that you so direly need.
Okay, I'm just going to be very objective here. It's, there are ways that donors give money to governments, and there are ways that the government is supposed to use that money to the people. So what we need, because even us, when we saw the budget, we still had questions. Where is this tea? Where is all this? But we have to remember that the people who are exactly first line on the job, they work 24 hours. There are those ones who don't go home. There are those ones who stay 12 hours shifts and then change. They don't leave the facilities at all. So like, for example, the ones in Bagathi and other areas where they've been having those isolated places, they can't leave and go and buy mandazi or tea outside. They have to be provided with breakfast, lunch, and dinner. And it is not only for one day, it's for months. In fact, it's for months, and maybe we don't know, we are not the ones using the money, but it might be for a long time. So we have to remember, it's not just tea that's given to the politicians and all. I'm not saying that I'm supporting the thing that has been rotating, but I tend to think that we must ask for answers. We expect the government to really break it down for us the right way. We want them to give us the information the right way, not things that are just going on WhatsApp and all, because not all of us are experiencing or benefiting from that kind of treatment.
And these are really good insights. That is information that I was not privy to. So thank you so much just for trying to explain to us who do not have the understanding of how things actually operate within these facilities. I am really curious though, Dr. Irene, unataka kutuma salamu nyumbani as we try and wrap up, maybe last words, last comments, I don't know, say hi to a few people.
I'll give a shout out to my mom and family. They're under lockdown in South Africa. So I hope they're doing good. And my colleagues at St. Francis also, and my Dr. Grace, Brian, and Ruby.
All right. Great. Dr. Chepto, same thing.
Okay, so I'd like to say hi to my mom and my brother who are around, my sister who's in Australia. I hope you're seeing this. My dad, who's also in Shags, wasn't able to come into Nairobi. And Nairobi Hostel Fraternity, my fiance, and everyone else. Thank you.
Okay, nice. nice. Dr. Karen, salams is a must. Please send your shout outs.
Yes, I want to send my shout out to my whole family, especially the ones whom I've not seen, my mom, my dad, my brother, my sister. I live with my other sister, so I'm sure she's watching this. Yvonne, hi. And all my friends and my colleagues, especially the ones who are still working even today, especially the residents. I'm an obstetrics gynecology resident here with Ida. So we want to wish them the best, especially the ones who are currently working as the first doctors. Yeah.
All right, asante sana. Now, Dr. Ida, before you send your shout outs, someone says in December, around January, you might actually be very, very busy. Are we expecting a baby boom now that people are...
Oh my God, come, everybody come.